Hi, I'm Dr. Andrea Renee, Doctor of Acupuncture and Chinese Medicine, and part of my scope of practice is exercise therapy. That is part of my training. In addition to my acupuncture scope of practice training, I am also a certified Asian bodywork therapist and yoga instructor. And so as a personal trainer and yoga instructor working in gyms for 6 years, I have also trained clients on simple exercises, simple stretches that you can do that can make a huge difference. Stretching is so important. It's one of the things that we can neglect to do even if we're active. Stretching actually makes you 30% stronger. So that's a big deal. But also too, regular stretching, if we meet our edge of flexibility every day, our flexibility will expand and also be maintained. And that's going to give us full range of motion. We won't be trapped in our body, and we can alleviate patterns of getting stuck to ourselves. We get stuck together. So we have this wonderful spiderweb matrix of fascia tissue going through our whole body. And if we don't stretch and reach our range of motion, all of the ways in which we can move, then we become no longer able to move in those ranges of motion. So all of this spiderweb matrix of tissue is supposed to slide nice and easy and have this really nice flexibility. But that's only happening, that's only maintained if we use it. If we don't use it, we stick together like tape. So I'm sure all of us have observed seeing some other people, including ourselves, stuck together like tape, where we have trouble turning our head, for example, where, oh, we have trouble even standing up straight. We get the stiffness, the tightness, the pain. And that can contribute to radiating pain. So it's not even just in one area. So this video today is about giving you tools for low back pain. And low back pain can not just only be centralized in our low back, but it can also radiate down our legs. So I'm going to move back a little bit. So if you've had sciatica, so lower back pain that radiates either down the back of the leg or the side of the leg or the inner thigh, can go to the knee, can even go all the way down into the foot. Because again, we're this big spider web, this big matrix of tissue that's surrounding all of our bones, our muscles, lining our skin. And so if any one area is tight, it's like a rubber band, it pulls on the whole other area. And so things get spasmed, muscles spasm. The tissue doesn't slide. All of the layers of the muscle, it's supposed to slide to allow these amazing movements that we're capable of in this miracle body we're living in as a human being. But that gets interrupted by sitting too long, standing too long, doing the same kinds of repetitive movements without using our full range of motion. So if we can stretch every day, we can break this stuckness that happens. We can stop ourselves from getting these adhesions, these knots, and having this discomfort and pain, and having experiences of radiating pain or centralized low back pain. So this is a lower body set. And one of the things I invite you to do is think about, when is the easiest time for you to do this once a day? So I have this yoga mat out, but you don't need a yoga mat. Your bed is flat too. And one of the ways we can tie in a new habit and never forget to do it is if we tie it into bed. We're all going to lay down at some point, and we're all going to need to sleep. And ideally, we will lay down and sleep in a bed every day, all of us. And so if we tie in a healthy habit like stretching around getting in or out of bed, when we see the bed, we're confronted to remember, oh, I stretch now. So this can be done when you first wake up in the morning before you get out of bed, or this can be done when you get into bed before you close your eyes to go to sleep. So tying it in, it's really only going to take about 5 minutes, but it can make a huge difference for us long term. Because what happens is we have the sciatic nerve coming from our spinal cord, going down out of our spinal cord and going down into our leg. Because we need a huge nerve connection to send messages back and forth through our legs. So there are these big branches that come out, and the sciatic nerve goes through this muscle in the center of our buttocks. It's called the piriformis muscle. When this muscle gets stiff and tight, it can squeeze that sciatic nerve and make the radiating pain. So you don't necessarily have to have a disc issue like a herniated disc or slipped disc or have had a back injury. And even if you have those things, that's not necessarily the source point. The source point can actually be the piriformis muscle. And so this is a piriformis stress set here. We want to clear all the tightness and tension in that muscle along with the other muscles of our legs and lower back. So now we get to start. It takes longer to explain the value, right, and what and why we're doing than to actually do it. That's what's so fun. So now we're going to get into that stretch set. So we want to stop lower back pain, lumbago, stop radiating pain, sciatica. It doesn't need to happen anymore if we just meet our edge of flexibility every day, maintain it, and expand it with these simple stretches. So let's get started. You can be on your floor, you can be on a yoga mat, you can be in your bed. Find the easiest place where you can do this for yourself. Take this 5 minutes a day. I like to do things before I get out of bed. I'm not allowed to get out of bed unless I do my 5 minutes of stretching. I can never forget. I can't even get started with my day without doing it, because I will have a different day if I do it. That is for sure. So let's go ahead and lie down. Now, one of the things I want to remind you of is we do have this matrix tissue. Our whole body is connected by this amazing fascia tissue spider web. And so we're going to do some releases for our ankles and our feet, because if our ankles and feet are tight, they're going to pull all through the legs down onto the lower back like a tight rubber band. So we can have low back issues because we actually have a foot and ankle tightness issue that starts to become a calf and a behind the knee and behind the thigh issue. So we want to clear all of this in this simple set. So let's go. So as we're laying down, we're going to start with the ankles and the feet. So if you were to follow my hands too, you're going to point your feet. So we flex back and we extend forward. We're going to do these 3 times. Flex back and extend forward. Now we also want to do our side range of motion. So we want to point to the left and we want to point to the right. And again, we're doing these 3 times. So 1, 2, 3, and really point. Go as far as you can on these. And then we want to do some circles. So we're going to go clockwise, tracing circles 3 times, and then counterclockwise 3 times, stretching out our feet and ankles. Now, we want to take one knee at a time to the chest. We want to take a big, deep breath. Now, if you took 3 big, deep breaths, that's about 15 seconds. That's an ideal amount of time to stretch. And then release the knee down. So again, the other knee down, taking 3 big, deep breaths. And 3. And now we want the other leg to come up and doing both knees bent to the chest. Now we can also stretch our neck as well. We can have our nose to knee. And again, wherever your edge of flexibility is, just meet it. Maybe your legs don't come all the way back to your chest. Maybe it's hard for you to touch your nose to your knees. That's okay, it doesn't matter. What matters is that you go to your edge every day, and then eventually you'll be able to pass your edge, it will expand, more and more flexible. So I've been doing these stretches for 13 years, so I've built up some flexibility over time. That's all. So let's see what you can do. So now we're going to do that figure 4 where we cross the ankle over the knee. See how flat, as far as how far out your knee can go. And then we lift up. We're going to take between the legs. So my hand reaches between the legs and grabs behind my knee. And I'm going to flex. I'm going to lay down my upper body, have it totally relaxed. So my elbow, you'll see on the other side, my elbow actually goes against my leg. So I want to see how far back with my foot flex can I bring this leg. So this is a figure 4, and this is a 90-degree angle. So now I want to switch. So again, the figure 4, ankle to the top of the knee, figure 4, reaching through my legs with my opposite left hand, and then coming around with my right hand to interlace my fingers behind my knee. And then I'm going to see how far of this 90-degree angle I can keep. And then letting go. So now we also want to extend up, because when this back of our leg, our hamstrings get tight, they pull on the lower back. It can be very contributory to low back pain. Now too, you can see, can you flex? And how far up can you come with your hand? So how straight can you keep your leg? Where can you hold your leg with your hands? Can you touch your toe? Can you grab your toe? These are all stages of flexibility. So maybe in the beginning you can just go here. That's okay. What matters is you go to your edge. Now you don't have to push hard through your edge, just meet it. Just meet it and breathe into it. 3 big deep breaths. See where you land and breathe into it. 3 big deep breaths. So now we want to do the other leg hamstring. So here with the right leg again, how close can you bring the leg to your chest? How straight can you keep the leg? How far can your hands go up the leg? Each day it's a discovery as you move on to new levels of flexibility. Can you touch your toe? Can you grab your toe? Where do you land in your edge of flexibility? Wherever it is, go ahead and breathe into it. 3 big deep breaths. Now, one of the most important ones is for the lateral sides of the legs. So you have seen this usually if you've taken some kind of hatha yoga class. So we're going to take our foot flat on the ground on the outside next to our knee. We're going to take the opposite hand and put it on the knee. We're going to relax our whole upper body as much as we can, and we're going to see how far this leg can come with the weight of the opposite hand. So this is my right leg. My foot is flat against my outside of my left knee. My left hand crosses over to my right knee. I keep my whole upper body flat. My other arm is on the ground, and I just see how far can I go to stretch this whole lateral hip area. And now we want to do the opposite. Right leg down, left leg up, left leg with the foot on the outside of the right knee. Then the right hand comes to the left knee to give some weight to enhance this stretch along the left thigh. And we took our 3 big deep breaths. So it's not that many movements. What's most important is that we do them each day. So we want to meet our level of flexibility, come to our edge of flexibility every day and meet it. Then it will expand. We'll become more flexible. We'll reduce pain. These simple stretches, when can you do them? Before you get out of bed, when you lay down before you go to sleep. Now, too, they can be done as needed. For example, you've been driving. That's one of the things that can kick in low back pain is driving and also using our right leg a lot. If we don't have a stick shift and we have an automatic car, our right leg is pretty much doing all of the driving, and that can create low back pain and some sciatica issues too. And so you can take a few minutes as needed too after you've been doing sitting or standing for a long period of time driving, but at least once a day is the trick. Can you do it in the morning before you get out of bed or when you lay down before you close your eyes to go to sleep? Even just one set of breathing 3 big deep breaths in each of the positions will make a difference for you. That's what's fun. So whenever we do the work, we're guaranteed results when it comes to the human body. So I invite you to see, when can you adopt this practice of lower body stretching, releasing your ankles and feet through your legs up to your lower back. And I'm excited for you to get results and maintain them by keeping up the practice in just minutes a day. It's mind, body mastery in minutes a day. So when can you take 5 minutes to be your own medicine and help yourself? It's free. It's just a time thing. So when is the easiest time? So I encourage you to adopt a new healthy habit that's going to give you greater quality of life, like this 5 minutes of lower back sciatica stretching. One new habit every 4 to 6 weeks. You don't even have to add a lot all at once. Just start with 5 minutes once a day, and then you can work up from there, adding other healthy habits that will deliver results for you long term and enhance your quality of life. That's what we're doing. We're building your toolbox. So this is lifestyle designed for you to address any of the messages your body's been sending you, like the lower back pain with or without the radiating pain of the sciatica. So enjoy adopting these, and I will see you next time.